Hello and welcome to this short webinar. My name is Jess and I am an accredited practicing dietitian at Empower Healthcare. Now today I would love to briefly discuss with you what a dietitian does, who we can support and what to expect from a consult with a dietitian. So to begin with, what does a dietitian actually do? As dietitians, we use the science of food and nutrition to promote well-being, independence and health. We specialise in providing medical nutrition therapy for the treatment of a wide variety of diseases and health conditions. Dietitians really understand that there is no one-size-fits-all approach when it comes to nutrition therapy, and it is at this unique individual level that a dietitian can really help. As dietitians, we consider the whole person. That is, we consider each person's unique circumstances, including their medical history, their needs and wants, their goals and their lifestyle. So who can a dietitian help? Dietitian can see people of all ages, all genders, all nationalities and all financial circumstances. We can also see clients with a large variety of different medical conditions. Now this may include individuals with developmental conditions, and the reason for this may be that the clients have nutritional deficiencies due to selective eating habits or food refusal, or they may even have increased kilojoule requirements to ensure optimal growth or optimal development. We can also see clients with food allergies or food sensitivities or even food intolerances. And the reason for this may be that the client might be nutrient deficient due to the avoidance of these foods. Where we can help is to assist in the identification of these specific food triggers and ensure nutritional adequacy despite exclusion of these specific foods. We can also see clients that have gastrointestinal disorders. This might be because the clients are experiencing altered bowel habits or associated symptoms, so things like nausea or vomiting. As dietitians, we can really help with symptom relief, ensuring nutritional adequacy and preventing symptom flare-ups through dietary modifications. We can also see clients who have mental health disorders, and this may be because a client may have developed a negative relationship with food, which may have led to nutrient deficiency. As well as this, there are key nutrients in recommended quantities that may assist with improving mental health status. We can also see clients with neurological conditions, as well as we can see clients for general healthy eating, fussy eating, cardiovascular disease, diabetes or heart disease, or weight loss, weight gain, or even malnutrition. So as you can see, although this list is quite extensive, there's a wide area of clients that we can work with to help support. So what should you expect from seeing a dietitian? Firstly, as dietitians, we understand that people may be more comfortable in certain environments than others. So for this reason, we can visit the client in their home or a setting which will suit them best, which might even be a different setting which can be arranged with the client. We can also chat via telehealth if that makes the client more comfortable, and this may be through a video conference or even just the telephone. Now, the first appointment with a dietitian will often include doing a nutritional assessment where we find out a bit more about the client's unique circumstances and what they are actually wanting to achieve with seeing a dietitian. We will also discuss medical history, any symptoms that they have been experiencing that have been a bit problematic for their health, ask questions about the client's current diet, any food allergies or food dislikes, nutrition-related concerns, their physical activity or movement, as well as questions regarding who does the shopping and cooking, and also what other supports the client has that we could potentially link in with to help support the client to the best of our abilities. We may also take measurements, including height and weight, which we use to inform our calculations of a client's nutrition requirements. Now, using this information, we can then provide feedback and nutrition education to help clients reach their goals. We will always make sure to consider the client's unique circumstances and what supports that client may need to implement these recommendations. If follow-up appointments are required, dietitians will work with the client to make further changes to help the client with reaching those goals. The session will often involve discussing strategies that the client may have tried, as well as understanding any challenges or barriers that may have come up since the previous consult. So if you would like any further information on how a dietitian may be able to help, please feel free to call Empower Healthcare at 1300 043 578 or send through your referral by completing our online referral form on empowerhealthcare.com.au. Thank you so much for your time.